You yell at the kids, you yell at the wife, you don't sleep again. It goes round and round and round in circles.
Do you mind lifting up the top so I can see that area of the back? It's up to you.
No, I'm sorry.
You don't want to do that?
I didn't know how much it hurt. It does hurt.
What about when I'm pressing here? So when did you learn to do this?
Last week. Deep breaths for me.
You put your head between your knees now.
What do you mean, like just
Yeah.
Every cigarette Dan smokes takes 11 minutes off the end of Dan's life.
Morning, ladies.
Hello, Fun and Rose Surgery. Nikki speaking. How can I help?
Down we come. Come in. More coming? Oh, my goodness, how many more?
Too many.
Too many. Right, who's first? Good. What's the problem?
She's got very nasty cough, so she's been having a fever from last week. It's better now.
Okay,
But
so we have a listen, yeah?
well, in terms of the temperature, but...
Shall we lift this up at the back?
breath.
Oh, my goodness. Oh, you're very good.
Girl.
Let's have a listen. See. Deep breaths for me. Another one. One more. Good, OK. Look, she's fine. The fever's gone, OK? So it means the acute infection's over, OK?
Yeah.
You still have some inflammation of those airways, and the result of that inflammation is that the body says, look, well, there's something here, let's try and get rid of it. So the cough will go on, but there's nothing that we can give her that's going to change that, OK? This is up to her own immune system to finally get on top of it. And he's got the same thing.
Yeah, pretty much.
Family share everything. Although he feels hotter to me. So he's different, because he's got one side over here is really crackly, so he does need something.
That's the first time you haven't cried at the doctors.
Oh, do you normally cry at the doctors?
Oh, yes. You like doctor, yeah?
You like the doctor? Good. OK. Because don't forget, it's not the doctors who are nasty, it's the nurses. They're the ones that always... The doctors are always very kind, the nurses, ooh.
It's not funny?
It's not funny, oh dear, OK. So you need to give him 1 teaspoon 3 times a day, OK?
Okay.
Keep going. If he's getting fevers and temperatures, you need to keep going with Calpol or Nurofen, yeah? Make sure he drinks lots of fluids. If he's off food, that's not so important, OK? He's not a thin child. He needs to think about a career in rugby. That's a good sport.
Oh, yeah. Yeah.
Start them early.
Not funny.
It's not funny either. Oh, yeah, I'm failing.
You're gonna be ballerina?
I'm failing terribly today. There we go.
Yeah.
That's yours. Can you hold that for Mum?
So you're
Thank
say
you.
Thank you to the doctor.
Thank you. Are you going to shake hands? Very good to see you. Are you going to shake hands as well?
Josh,
See you later, everybody.
thank you very much.
OK, any problems you're worried, come back, yes?
That was a nice doctor.
Bye.
I'm Julie. How can I help?
She has a very worse headache in her head. So I go to the pharmacy. Last time I come for the doctor say buy from anywhere, but the pharmacy say without doctor prescription they're not allowed to shampoo to the children.
All right, for the head lice, they
Yeah.
can't get it from the pharmacy. So have you noticed any head lice?
Yeah.
You have?
Yeah.
And when did you...
I use lotion, but it's not work well.
OK, let's have a little look, Pop it.
Lots of.
Is this where you're itchy, back here? Yeah, I think these are just the little eggs, aren't they? Yeah.
After lotion, when I come,
Yeah.
lots of lies on the paper.
Oh,
Lots
you've
of.
been using the little tiny comb?
Yeah.
Yeah. So has this little one got head lice as well?
Yeah.
And have you got any... So you've not been able to use any treatment for him either?
Not.
Okay, so this is the one that they recommend, the Malathion lotion, because I think sometimes some of these over-the-counter ones, the nits have got resistant to them, so they're not effective. But you're doing all the right things by using the comb and getting rid of the lice that way. Once you've treated it, just keep her hair nicely tied up and out of the way. So that's the information there. You can get more information online if you need.
What's your date of birth, Ada?
March 1936. And I'm 21 today. That brought a smile in your face.
Oh.
Hello, mate.
Hello.
Come and take a seat. Right, I've got a very special machine here for you. It's old-fashioned,
Old-fashioned, that'll do me.
but I trust it.
I've lost a stone in 4 weeks.
How did you do that?
I've joined a walking club in Langley.
Good. Well done. Let's put that on. I mean, your blood pressure is fantastic today. 126 on 78.
There's another problem I got.
Oh, dear.
I think
What's-
I might have a bit of depression.
OK.
I'm constantly angry. I'm snapping at my wife and kids. I can't sleep. I'm exhausted when I get up in the morning.
What do you think has brought that on?
I don't know.
So everything else is perfect. Job's great,
It can be stressful at times.
but it's no different to what it would normally be like.
No.
Any problems in the family?
No, not
No?
really. Nothing's changed. Just that I'm always agitated. I don't cry.
Yeah.
I've been emotionally lately.
What does your wife say about it?
She thinks I'm stressed out at work.
Yeah. So what are you thinking about when you can't sleep?
Um,
Normally it's because you've got
it's
thoughts
work.
whirling around.
It's
in you.
work.
Yeah. But you don't think it's stressful?
I don't, but perhaps it is. Everything's got to be on time, deliveries. If it's late, you get fined.
I mean, that sounds stressful to me.
You okay?
Sorry, he's vomited on the floor.
Oh, you're not well.
She started just coughing and she was vomiting and she couldn't even eat.
It doesn't hurt.
Big ah, as loud as you can, like a tiger. Ah. Very good. How can I help with Alessia?
Alessia's been sick for the past 2 weeks.
Yeah.
A bit of temperature. He was going school and I was giving him Nurofen and Calpol. But now things for the past 4 days have become terrible. Cough, sore throat, bad smell from his breath. In the night, he shivers a lot. And fever, he's
How high is this fever?
around 39.
Okay, well, just slip off your anorak and your jacket, yeah. That's right, good. Just have a look at your throat. Just open your mouth like a big shark. That's right. And say, oh, and loud and long. That's really good. Yeah, it sounds for horse. Let's just listen to your chest, Alessia. Big breath. Again. Nobody smokes? Just right there, yeah. Yeah, the issue with smoking is that even if you never smoke in the house, the nicotine paralyzes the little cilia, the little hairs that are inside in the ears, the nose, the throat, and the lungs. And these little cilia just are like an escalator. They keep the mucus moving, and the mucus traps bugs and viruses. And then you clear your throat and you swallow the mucus, and that's how you clear your lungs. In children of smokers, that doesn't happen. And so it's easier for them to get ear, nose, and throat and chest infections. He has a chest infection at the moment. And so we give him an antibiotic.
He's literally stopped eating anything except for a piece of bread. Can I give him ice cream that's soothing it?
Yeah, you can, absolutely, yeah. So jelly and ice cream, you could give
Jelly
him.
and ice cream?
Yeah, yogurts, mousses. So fluids with a very high water content would be best. Custard.
Custards.
Good, yeah. Doesn't matter if it's hot or cold, just not too hot for him. He'll still be coughing, I'd say, for about another 2 or 3 weeks, so don't worry about that. But clearly, if you can help Dad, every cigarette Dad smokes takes 11 minutes off the end of Dad's life. But also, I'm just thinking about
Yes,
Alessio
that's
in this case. There's a poster upstairs. in the waiting room upstairs, you pop up and just take a photograph of it. It might just help to stimulate your determination to kind of think about stopping, you know. It's hard, but it's well worthwhile. You live longer, you'll be a lot healthier, and you won't be heir to all the things smoking brings us. Okay.
Thank you so much.
You're welcome, yeah, all the best. Bye-bye, Alessio. Hopefully you'll feel better soon. Yeah.
Thank you.
Yeah. Bye now.
There are two ways that we look at depressive illnesses and the way we can treat them. Sometimes, you know, we try and look and find if there's a cause. Now, if you came in and said, look, you know, my wife beats me up every time I go home from work, the kids laugh at me, I just lost my job and we're going to be kicked out of the house, and, you know, even the dog's smiling when I walk in because he thinks I'm a loser, you know, and your mood goes down. Sometimes we can't find a reason for it. You know, we sort of say, well, is this a thing called endogenous depression? Is it coming from inside? Is there a biochemical reason for you to be sort of more depressed or feeling like this?
The job I do, it's only recently because I got a new contract. Because I'm constantly thinking, is that going to be out in time? Is that, and when I go to bed, I'm thinking, what's going to happen the next day?
Okay. And so therefore you don't sleep because you're thinking about it. You wake up the next morning, how do you feel? Tired, shattered, and that's before you start work for the day. You get home, you yell at the kids, you yell at the wife, you don't sleep again, and you're worse the next day. It goes round and round and round in circles, doesn't it? I'm going to give you a number to call. Okay, it's called Talking Therapies.
The thing is, it's fitting time in to talk to them with the busy schedule I've got.
I understand that, but you've got to make some effort to... Well, you've got to find something to be able to, you know, help yourself. Imagine 6 months' time, if you don't do something about it, what are you going to be like then? So something has to change. It may be that you need to tie in appointments around when you're doing some of those heavy shifts. But I think if you don't make a start, then you're going to be in the same position or worse 6 months down the track.
Yeah.
Okay. I mean, I'm not averse to using antidepressants, but I think that you need to look a little bit further than just throwing a medication at these sorts of things.
Yeah, OK.
Oh, hiya. How are you?
Oh, wonderful, thank you.
Good, good. Come through. How are things going?
Great.
Yeah?
Yeah.
Taking the meds?
Oh, yes. No side effects.
Good.
No hot flushes, no...
Excellent. Let's see what your blood pressure is doing. Not great. Better than last time. So it's still higher than what we'd like it to be.
OK.
So I think you need to increase your medication because you've been taking that for a good few weeks now.
Yeah, 2.5 weeks now. This is the lipstick that I was wearing now, this one.
Ah, OK, yes. Okay.
It's amazing. And that colour, that they've started doing that colour as well.
Thank you.
So I'll show you. And
you remembered?
Yeah, of course. Being a teacher, I remember every little things I need to do. So I brought a little gift for you.
Oh,
because I'm an artist, so this is one of the prints of one of my paintings. I'm working on new ideas for Guru Nanak Dev Ji.
Yeah.
For our younger generation.
Wow, this is amazing. And this is your work?
Yes, this is my print of my original.
That's beautiful. That's really nice. I'm touched. That's such a nice gift.
Right, thank you. Anything that I earn from here goes back into a charity.
Yeah.
I don't need any more hats.
Yeah.
So, you know, and clothes and lipstick.
Yeah.
So
you'll have to come and talk to me about it properly
sure.
sometime. That's amazing. Do you know, I'm in the process of doing up my house, so this will
really?
definitely have a nice place in it.
Ekonkar.
Do you?
But big ones, like on canvas, but they're all in gold and rhinestones and things.
I'm going to have a look at some.
Oh, definitely. I'll bring a sample in next time. But I'm so thankful.
OK, just before you leave, we will need to recheck your blood pressure again, say 2 or 3 weeks' time. Just book an appointment with one of our healthcare assistants so you don't have to see one of us. It'd be really easy to do them to check your blood pressure. Hopefully it will bring it down to a decent level. OK.
Great, thank you. Bye.
Bye.
How can I help?
It's a bit hard to explain it, but basically I'm getting like cold and flu-like symptoms again. I've been off work for about a week and I just feel really run down. I'm getting married next Wednesday.
What are your symptoms today?
Obviously I'm not getting a good night's sleep for the past week because I can't breathe properly and I'm waking up during the night. There's a lot of like, I wouldn't say fluids, but kind of like mucus.
Can you put your head between your knees now?
Put my head between my knees.
And just hold it there.
What do you mean? Like just
Yeah. So are you coughing at night at all, or?
Yeah.
You have been?
Yeah.
Is it worse at night than in the
I take my
daytime?
inhaler, so yeah, it's a lot worse at night than obviously during the day because I'm just in bed, so I'm not really doing.
And the stuff that you're sort of producing, what colour is it?
Like in the mornings, it's like yellowy, greeny, almost, and then throughout the day, it's just normal. Like,
And then is this over what period of time has these symptoms been getting worse?
I'd say this is the second week, and they've started to calm down now.
Okay. How are you feeling now?
Got like a bit of a head rush, but it's only on one side as well.
Do you feel like there's pressure?
Yeah, like here, like there.
When you've had antibiotics in the past, have they helped?
Yeah.
Have they helped?
It's cleared it up, yeah.
Okay. Because I think the history, the way you're describing it,
Yeah.
I probably need to give you some antibiotics. I mean, looking at your latest outpatient letter, they're just pulling stuff together.
yeah.
So I don't want to sort of second guess that. So you're getting married next week?
Yeah.
You're going on honeymoon?
Yeah, 2 weeks. Don't know when.
Oh, it's a surprise,
yeah.
is it?
Came in last week to get my injections and stuff as well.
So you don't know where, but you've been told which injections to have.
He actually came in with me and he was talking to Julie, the nurse. So he's planned it really well, to be fair.
Well, have a lovely time.
Thank you.
There you
very
go.
much.
Take
Thanks
it
for
easy.
your help.
Bye-bye.
Take care. Have a good day.
When some people have an ingrained toenail, we put a chemical in the corner to stop it growing out as wide.
Right.
And I think the reason why I decided not to do it is because you'd hit the nail in the first place. It
Yeah.
wasn't because you're naturally ingrowing.
No.
So I think if we take the nail out, hopefully it will just grow out normally again.
And if it doesn't, I suppose, then what?
Well, if it doesn't and it comes back in growing, and if we come to the stage where we have to do this again, then I would do the phenol at that stage.
Right.
Do you want me to run through how it works again?
Yeah, please.
So if that's your toe, basically what we have to do is put an injection on that side and on that side, because you've got nerves that run along here.
Yep.
And what we want to do is try and block those so that you can't feel anything in the toe. And then what we do is we put something under the nail to lift it all off, and then pull it off. And that's it, really.
Oh, right,
And there you
okay.
go. So do you want to come up on there?
Yes.
OK, so for this bit, the most important thing is that you keep the toe really still, OK? So whatever it takes to do that, whether it's screaming, shouting, I'll take all of that. But as long as the toe stays still for me, OK?
So when did you learn to do this?
Last week. So we've been doing these for about 4 years now, I think.
Oh, right.
Yeah. So just tell me, can you feel anything there?
No.
No? Can you feel any pushing and pulling or sharp? Nothing? OK. If it feels sharp, just stop me, OK? So far, so good?
Yeah, so far, so good. Do you want your nail taken off, Linda, while you're at it?
That's it, that's done.
Oh, wow. I didn't feel a thing.
I don't think it's going to bleed through because it was oozing a bit at the end.
Yeah.
If it starts soaking through, it'll happen today. If that happens, I want you to come back in and just tell them at reception you've had minor surgery and you're bleeding through the dressing. They will find someone to sort it out for you.
OK. Are we done? Yeah.
We're all done.
Oh, thank you. OK, thank you very much
Okay,
indeed.
okay.
Thank you. Thank you. Oh, at least I got a crutch. Nice to meet you. I hope that was interesting for you.
Take care. Bye.
Thank you. Bye-bye.
See ya.
Thank you very much. How can I help today?
I'm in an awful lot of pain, Doctor.
Where?
All in my back, all down my left side, and I keep going dizzy on one side.
Dizzy on one side. What do you mean dizzy?
And I get up sometimes, and I go turn round and I'm...
Right, OK. And you were having lots of tests done. You've been losing weight, haven't you?
I've lost an awful lot of weight.
Right, so who's seeing you about that?
Nobody. I've had scans, I've had 4 scans, I've been having blood tests, and I'm getting no further forward.
And the pain, is it any better on the Oromorph?
No, nothing seems to be shifting now. I know I've got cancer on one kidney.
Right. You had breast cancer, didn't you, June?
Yes.
But you were cleared from that, yeah?
Yes.
Where is your pain?
Oh, it's all here.
You slip your jacket off. Show me where your back hurts.
Yeah, right down.
Right down there. OK. Oh, I'm sorry. You've lost such a lot of weight, June, haven't you? There's nothing off you there. It's all bone. OK, the Oromorph helped. Then we should get you some more Oromorph while we try and chase up these results. Find out what's going on, because then we've got a clearer idea of how we should be treating you.
So much pain. I can't sit very long. It starts off again. I'm not sleeping properly.
You've had a scan. They should be reporting that, and they should be seeing you for the results. Yeah? What I'm going to do is get you some Oromorph, yeah? And then what we'll do is we'll try and chase up the results. So how much of the morphine were you taking when you were taking it?
5 millimetres.
5 or 2.5?
There's a little spoonful. Tiny little ones.
Tiny little spoonful. Okay. But that did seem to help with the pain?
A little bit.
A little bit. Okay. Can you come back and see me in 2 weeks, and I'll see if I can get some Joy out of the hospital, okay? And that's something for the pain. Until we know exactly what's going on, it's difficult to know what's the best way to treat your pain, but we need to have the result of that scan. Yeah? You two take care.
Thank you.
Bye-bye.
See you later, love.
Hello.
Hello.
Hiya.
Hello.
Hi, that's
My name's Simon. I'm a final year medical student. I'm a final year medical student.
Well, it's not my fault.
Have a seat. And this is George. Yeah?
That again?
George.
Who's he?
It's not you.
I'm not George.
Who are you?
Mr. Bennett.
No, Mr. Bennett. I think it's because I'm confused. Because the other nurse called Bennett.
No, my name's
And I
Bennett.
called. Yeah. When I was
When I went
called-
up there, somebody shouted out for Bennett and I walked in.
Oh, so maybe someone else called you.
Yeah. Sorry, dear.
All right, I'll go sit down here.
Brie, have a seat.
Last week, Thursday, I went to hospital from work because I'd fallen down the stairs and had a fit. So my manager wants me to come in to check that I'm fit to go back to work.
So when you say you had a fit,
Yeah,
what
they
happened?
said that apparently I don't remember going from the top of the stairs to the bottom, but apparently my manager said that I'd fallen and I was shaking on the floor.
Right. And did they say that you had bit your tongue at all?
No, I had a mark on my lip where I'd fallen, but I hadn't bitten my tongue.
Had you weighed yourself?
No.
Okay. And were you feeling okay?
Yeah,
Sort of no
I was just a bit tired, but other than that, I didn't even have a clue. And then when someone told me, I thought, no, I didn't fall down the stairs. What are you talking about?
Oh, I'm hungry now. Hungry? I know, I want my spaghetti and sausage. You brought a can with you? Yeah. So excited. I hope there's a lot of sausage in it.
So you went to A&E?
Yeah, and they didn't admit me. They just let me go from A&E after they'd done all the tests.
Okay. And this is the first time something like this has happened? Any family history of epilepsy or
No.
fits or anything? Okay, and they've definitely referred you, have they?
They said they were going to, yeah.
Just gonna take a look at your bloods that you had done, if that's all right. Just give me a second. And how have you been since?
Fine. I've had a week off work because I had annual leave for my birthday anyway, so...
Oh. Did this happen on your birthday?
No, it happened on the last day of work.
And you've been well since? Okay. Do you smoke at all?
Yeah.
How many cigarettes a day?
Maybe like 15, no more than 20. I don't have more than one pack a day.
Okay. Ever thought about cutting down?
Yeah, I have cut down quite a bit. I used to go through like maybe 25 to 30, but I'm starting getting there. But it's more when I go out with my friends, it's more like, so I'm all right when I'm at home, I don't smoke so much.
Okay. So you're aware that it's not the best thing for your health?
No.
Okay. Alcohol. Drink much alcohol?
On the weekend, I'll have a drink with my friends, but I'm not out every weekend because most weekends I have to work. So.
Okay. So it's not a regular thing at all? Do you drive?
No.
Okay, excellent. Did they tell you?
Yeah, they asked me not to, so
Fine.
I said, fine, I don't drive anyway.
Okay, good. That's not going to impact on your life. Excellent. Definitely until you see the neurologist, okay, and they've done some further investigations. Take it easy and see how it goes. I mean, obviously, I can't guarantee that it's not going to happen again. I don't think you need to stay at home until you see the neurologist, okay? I think, you know, if it happens again, then we need to reassess the situation. Yeah. All right, take care. All right, let us know if there's any problems. All right, bye-bye.
Bye.
Karina Carty, please. I'm Dr. Tawana. Nice to meet you.
Hello, nice to meet you.
Thanks for waiting. How can I help today?
I've had a headache since Saturday.
Okay.
It's happened for like the last couple of months now.
Yeah.
And it lasts for weeks and nothing works.
Okay, let's ask a bit more about it. So when the headache comes on, could you just describe what it feels like?
First it starts off niggly, it starts off around here, then
Yeah.
it's like a pounding pain.
Yeah.
And then my eyes just start,
Yeah.
I can't open them, the light hurts and everything.
Right, okay. That's interesting. So the light hurts. Do you get any feeling of wanting to be sick, so nausea?
I did yesterday, I was throwing up yesterday.
Yeah. What do you tend to do then when you get these headaches?
I just lie in the dark room to try and go to sleep, really.
Does that make a difference?
Not really.
Not
no,
really.
I wake up and it's still there, yeah.
What makes the headache go away?
Nothing, it just goes away by itself.
Goes away by
I'm
itself?
not sure why, just all of a sudden it'll just go.
And after how much time does the headache
After
normally?
about 2 weeks it will
Right.
go. So
Gosh, it lasts that long?
Yeah, it lasts
Wow.
quite a while.
Wow. And have you noticed if there's anything that triggers these headaches? Perhaps something you're doing, eating?
No, because I've started to eat healthy, so
Yeah.
I'm not eating all the junk foods and so I'm eating green foods and that.
And have you thought about what these headaches might be?
No.
No.
just want them gone, really.
Right.
I've been to the opticians to make sure that it's not my eyes.
Good.
That was last
That
month.
was all okay?
And that was absolutely fine, yeah.
Great, good. So just based on all the types of symptoms that you're getting with this headache, I am 100% confident that this is migraine. It's a classical history for migraine.
Okay.
And so I'll break this down for you. Frontal headache,
Yeah.
pressure feeling behind the eyes, light being sensitive, you wanting to lock yourself away in a quiet, dark room, sometimes a bit of nausea. That's textbook description of what migraine is like. And some people get them
Yeah.
for no reason whatsoever. Others, people just don't get them, yes. And all of a sudden they've developed. So there's some school of thought that we can think of migraines as brain attacks and brain inflammation. And therefore, anti-inflammatories tend to work a bit better. So things like ibuprofen hasn't really helped. In that case, what I suggest we start today is a specialist migraine medication. And you can take one of these tablets immediately, then wait 2 hours. And if in that 2 hours the headache has settled, you don't need to take any more. But if it hasn't completely gone, or its symptoms are still there, you can take another one after 2 hours. And in a 24-hour period, it's 6 tablets.
Okay.
Okay, that's the migraine medication. All right.
Thank you very much.
Hope it helps.
Nice to meet you.
You too. Take care.
So doctor comes from the verb docere, which means to teach.
We're doing hand notes, which doctors still rely on. If we're looking for abnormalities, we'd say no liver.
Okay. Teaching is fundamental to medicine. It's fundamental to improving the quality of what you do, and we teach each other.
If you like talking to people and working with people, NHS and this environment is amazing, really good.
Hi, I'm Dr. Taylor. I've got a medical student with me today.
Okay.
Is it okay if he initially asks you some questions and examines and then I can step in afterwards? Is that all right? Yeah?
Hello, my name's Simon.
Hello.
One of the final year medical students. And so is this Mary?
Yeah.
Hello, Mary. Hello. So what's brought you in today?
She got an ear infection.
Okay.
Yeah, this is the third time.
Okay, so she's had it quite regularly.
Yeah,
Okay.
in few months.
Mm-hmm.
Yeah.
Okay.
It's in her left ear.
In her left ear. And has it always been in her left ear?
Yes.
And so have you noticed any discharge from it?
Yes, it's coming. I just cleaned the outer ear, but
Okay.
still coming.
Yeah, okay, you can see bits there, yeah. Okay. And is it being kind of red and sore and...
Yeah, she was, last night she woke up around 1 o'clock and she told us that she's having pain.
Yeah.
So, and she was having temperature as well.
How long has this pain been going on, or
Uh,
this episode?
She complained pain last night.
Okay then. Has she been eating and drinking all right?
Oh, she's not eating much. Drinking, she's okay.
She's drinking
yeah,
okay?
She's drinking, yeah.
Okay, and urine output, that's...
Yeah, that's fine, yeah.
She's still... Okay. And how about she opening her bowels still?
Yeah, once a
She's
day
not,
she opened.
not abnormal, no diarrhea or
no.
anything like that?
No, no.
All right, then. Is it all right if I have a look in your ear? I'm going to look in your ear, okay? Oh.
Come on in and have a seat. Sorry about the confusion, Pat. I was on my way out to a visit. I didn't realise you'd arrived.
Yeah, no, don't be daft, that's all right.
I didn't think you'd stand me up.
No, I needed to see you because I've been taking the iron tablets. Today,
yeah,
It's the best day I've felt since I started them.
Good. So this all started because we did some blood tests.
Yeah.
And discovered that you were quite anemic.
Yeah, because I fall asleep.
So what I don't really understand is why your haemoglobin had dropped that much, because I checked it not that long ago and it was okay, but now it's dropped right down.
I haven't been eating very well. And I don't drink a lot. I drink coffee, don't I, Charlie? I don't drink water. They always nagging me to eat more. I don't eat veg, very rarely eat fruit.
Pat has Still's disease, which is juvenile rheumatoid arthritis. She was diagnosed as a child. It's an inflammatory condition that attacks her joints. And over the years, she's had lots and lots of surgery. Because of the amount of pain she's in, she's often been given anti-inflammatory medication, and that's also caused her some stomach problems. I think a couple of things. We need to have you on the iron. We need to bring your iron up, and that will make you feel better. And we do need to keep monitoring it to check it's coming up. The next thing to think about is why it's happened. So if you're not losing blood through your bowels, if you're not losing blood through your waterworks, then the worry is that you're losing some blood from higher up in your bowel.
I bleed a lot through the nose, a lot of nosebleeds.
I was thinking more of what happened last time, that you've got some inflammation there, yeah?
Yeah, Dr. Bulger, I can't even tell you. It's very swollen here, but when you touch it, I'm like,
So I'm going to do a referral for the endoscopy again, because it's a bit non-negotiable given how low your blood dropped.
Yeah.
We're going to have you on iron and we're going to keep checking that.
My dad died of bowel cancer.
What's the name, sorry?
Oh, no, I haven't got an appointment. Just kind of want to update something, so...
Can I take your date of birth, please?
Oh, don't call me madam, just call me Sarah.
Sorry.
There's no madam here, trust me.
That's it, that's fine. Yeah, that's it. So, yes, it does seem like obviously she has infection in the ear. That ear looks okay, although it is quite waxy, so I can't really see too much. But it doesn't appear to be painful. It's not that painful on the outside at all. She seems okay in her throat, and her chest is fine. So I think it would be worth giving her some antibiotics. So she had the ear drops before?
Last time they gave amoxicillin syrup, oral syrup.
Oral syrup?
Yeah.
Okay.
Do you mind if I have another look in that left ear? The one that's been bothering her, is that all right? Okay. Okay. My colleague's right, sometimes we do give drops instead of oral, but for young kids, often the cause is a middle ear infection, okay? And sometimes we need a couple of courses of antibiotics to kind of really improve things. So what I suggest we do is we give a different course of antibiotics, all right? And then I want you to come back and see us at the end of the week if things haven't really got much better. She otherwise looks, though, quite well in herself, and she hasn't got a temperature at the moment.
Simon did very well in this consultation, taking a very logical history and arrived at a diagnosis that he thought was appropriate. I ended up prescribing something slightly different. This wasn't a criticism on him, it was just a slightly different opinion, but I still think, according to his assessment, he made a very good judgment, and I think this is just part of the learning process for trainees.
Thank you, Doctor.
Okay.
Thank you.
See you later.
See you.
So yeah, I think that was overall a really good history. I think it was nice and concise. Overall, it was a competent examination. Just be aware of the order, especially for your exams. It's good to do things in a logical order, to show that you've got a routine. Often with kids, do whatever's going to be least distressing first.
Okay.
So if you start with trying to, wedge their mouth open and stick down their mouth, and if you do that as your first examination, then you're going to lose them, and then they won't comply with the rest of it.
Your blood pressure is fine. Your pulse is good?
Yeah.
How am I going to get you up on this couch?
I
You're
can
going to
do
be
it.
all right?
Yeah, I can do it. Charlie, just hold that for now. I don't know.
Oh, Pat.
See, I'm still quite mobile, like as such. I do my best. Yeah.
So that's where it's uncomfortable?
Yeah.
What about when I'm pressing here?
Uncomfortable, but here's the worst. There's the worst there.
Right. Come back and have a seat, Pat. Let's sort out a plan, yeah?
Yeah.
The surgeons seem to be done with you, is that right?
Yeah.
Well, not done with you, but there isn't anything else they can do to help, is there?
And I'm not having amputation, Dr. Bulger. Oh, no.
Have they suggested that?
Yeah. That they can take everything out my leg.
Yeah.
And start again and build me a prosthetic femur. It's offered to people that have had bone cancer. So I said, what will it do for me? He went, nothing really. It's if you feel you can't, cope with it. I said, no, then I'll stay with it. And then he said, the only option down the lane is if amputation, if it's... And I went, no, that's not an option either. And he said, you can talk to us any time, you can come here back any time, but we can't give you a new hip and another
Yeah,
knee.
I mean,
they've told me.
And it's better that they're straight, isn't it?
Oh,
So
yeah,
they
I
can and
want
can't
them
do.
to. I want them to. I've had more of a life than some people with rheumatism. And I've had children. I've had a life, yeah? But I'm still young and I want to enjoy a bit more.
I think Pat's one of my most inspirational patients. She's so cheerful despite all of the things she's had to contend with. She's always a delight to see in surgery.
You're done with the surgeons, but you are seeing the rheumatologist.
Well, I don't know
Let's
why
get
she's
this
seeing me,
sorted out.
because they said to me, your disease has burnt out. I said, well, I still get twinges, yes, but it's not. It's osteoporosis. And you also have osteoarthritis. I'm thinking, oh, God, another one.
When you see her, that's what you need to be asking, isn't it? What can you do that will materially help? I will do the referral. You'll keep on taking the iron. If any tummy pain is getting worse, if you're noticing any other changes you're concerned about while you're waiting to hear from the hospital, you call me.
Oh, of course.
You take care. Bye-bye.
How can I help?
I was on one of those exercise things and it fell and I hurt my back, and we saw a nurse today and she said that because it's not an emergency, we have to get a routine appointment with a doctor.
Okay,
So
fine.
we just got an appointment.
Right, when did that happen?
On Sunday.
Sunday, okay, and what were you doing?
The pull-up thing.
Okay.
And I was just
You're doing
using it and
pull-ups?
it broke.
Yeah.
Okay.
Yeah, I was just trying.
Okay, fine. Did you fall directly onto your back then?
Yeah.
Yeah, okay. And at the time, was it very painful?
Yes.
Okay, fine. How has the pain got since then?
At that time it was like really hard for me to like move around and walk and stuff.
Okay.
So now it's more easier for me to move around, but it still hurts a bit.
It still hurts? Okay,
Yeah.
fine. It's got better though. Okay. Now with this, have you noticed any pins and needles or numbness in your legs at all?
No.
Is there any weakness or difficulty lifting up the legs or moving them?
No.
No? Okay. Any problems when you're going to the toilet at all?
No.
Anything like that? Okay, good. I mean, it sounds like things are probably getting better, but we'll check you out and make sure everything is okay. All right? Are you happy for me to examine?
Yeah.
So what we need is to examine the legs on the bed, and also if I could have a look at the back, that would be quite helpful.
Come on in, what have you done?
I haven't got the foggiest.
It's going to sound a bit funny. He seems to have morning sickness. Is it going to go down?
I can't foretell the future. I can only foretell the past. I'm no good. I'm not a clairvoyant.
Apparently you do some special thing.
Okay. So do you know what special thing I need to do?
Something about some crystals or something in my head that you can like shake around and realign or
great.
disperse. Oh, bless you. So any ideas what you think might be going on?
I thought possibly croup.
What do you think's wrong with her?
I think she has otitis.
Otitis and tonsillitis. Okay, you could be right.
You're today's mystery. I can't think what this is.
Would you be happy for me to examine if there's a chaperone present? What I need to do is have a look at the back, get you to do a few movements, and then get you to lie down, and then lift your legs up, make sure the power in the legs is okay.
Just check the power.
Yeah. We don't need to take any clothes off if you don't want. Is that all right with you? Are you sure?
Yeah.
Okay. You're going to stand up for me. Okay. Now, so just stand there for me. So point to me where the pain is the worst.
Like around here
There.
and on the side.
Okay. Do you mind lifting up the top so I can see that area of the back? It's up to you.
No, I'm sorry.
You don't want to do that?
No, I didn't know. I just see the nurse.
Okay.
The nurse checked.
Okay, I mean...
Yeah, she's checked. There's not any bruise, nothing.
Okay, I mean, ideally we want to see. If you're not happy for me to see, that's fine.
Yeah.
But I'd have to find a different appointment with a lady doctor Consultations like this can be frustrating because an examination is an important part of our assessment, and without it, we don't have all the information we need to formulate a management plan. Having said that, it is important to try and accommodate a patient's wishes as best as possible and not to make them feel uncomfortable. The other option is if I can examine through the clothes. It's not ideal, but it's better than not doing anything at all.
You give other appointment for check the lady doctor.
Okay, that's up to you, that's fine. If a patient has a particular preference for a male or female doctor, it's best to mention this before booking the appointment. Patients can also be offered a chaperone who acts as an impartial observer. There's no routine appointments available that I can book this week. The other thing you could do is come back in the morning and book another appointment.
If she's no better for pain for after 2 days, then I'll come back again.
Okay, that's fine. I mean, it sounds like the pain has got better. What I'll do, let me give you a leaflet which has some information on back pain. Things to look out for. If you get any of these, then come back to see us straight away, all right?
Hug my teddy.
Do you want me to hug your teddy? Okay. What's Teddy's name?
I'm gonna name it Rosie.
Rosie? Okay. There. I've hugged the teddy. I've hugged it into my stethoscope. There you are. OK, it looks like you're walking around OK, and it's not causing you any problems. So, yeah, take care. Try not to injure your back again, all right?
Okay, thank you.
OK, no worries.
Thank you.
All right.
Apologize.
No worries, don't worry. That's fine. Take care.
Thank you.
Bye-bye.
I'm only 2 weeks out of surgery.
What did you have done?
Total knee replacement. I was only in hospital 2 days. I was quite impressed. But I didn't know how much it hurt. It does hurt.
Yeah, they say the knee is more painful than the hip.
Yeah. I was quite enjoying the morphine bit, but, you know.
Oh, dear. The morphine bit.
But, yeah, we're getting there. I got a lot of them in.
Yeah, you do.
Because I got a big knee, big everything. I've been through worse.
You've been through worse. Yeah?
If you want to have a go, you can have a go. I don't mind. I could be your experiment of trying to take one of these out. You're all right, 'cause the muscles aren't working properly yet. I can't kick you.
It wasn't that long ago that I was in Simon's shoes, having somebody watch over me while I consulted, and it was probably the most nerve-wracking thing you can do as a trainee.
Is that okay?
Very gentle.
The first time I examined a patient by myself, I was absolutely terrified. I believe I might have been sweating more than the patient was.
You're doing very well.
Oh, thank you. You're doing even better.
Am I doing the right thing here? Is the patient going to get better? Am I going to kill them off? What's going to happen?
So that's all of them out?
I was slightly dreading it.
Yeah, you were.
I was a little bit.
It wasn't too bad then.
I remember my first patient was an old gentleman who had COPD and had such an awful chest that really you could almost hear it from the end of the bed. But I was very excited to be able to put my stethoscope on his chest and examine him.
Thank you.
All right.
Oh, thank you. I don't know your name.
Simon.
Simon.
Yeah.
Simon, excellent job.
Thank you very much.
Nice to see you. You take care, and I hope the operation comes along as soon as possible for you.
Thank you so much.
That's okay. All right. Bye, good boy. Bye. Bye. You've been very good. Bye.
Bye-bye. Bye-bye, Hassan. Oh, I sneeze as well.